So for how long you had that hip problem?
I've had this hip problem probably also for a year. So my left hip has been really tight, came from a training injury. And just like all fighters do, it was something I didn't think about until I was looking. I'm like, man, why am I limping? Oh, my hip. And then I kind of like didn't really do anything about it until it went away. But now I'm noticing like I'm having limited range of motion issues, limited on my squat, limited on when I do my side kick, and it's also, you know, it's one of those things that bothers you in the back of your brain, and it's making me less confident in doing certain things.
Yes. So what's the pain level? Do you have any pain on that hip? Or?
Right now I don't have pain, but after I'm training, it'll be around like a 4, 5, or 6, and I find myself limping around the house for no reason, and it's just because I'm used to favoring this side. You know, I'll be sitting on the couch and I get up and it's a late. You know, I don't really feel anything, but I'm laboring to get up because I expect to feel pain, and then I'll just kind of shuffle around the house. My whole body feels tight because I'm protecting my hip.
So if this will be resolved, how it will make you feel?
If I were to resolve this, it would, I would feel so good just to be able to have my flexibility back, and also I would be way more confident and more energetic towards my training and my fighting hip.
So what's the number of pain when you squat down?
When I squat down, I feel a 3.
Okay.
Right now. So this way, I do feel some discomfort like in here when I go all the way.
Number?
4.
Okay, so let's do some range of motion of the neck. If you can turn your neck as much as you can.
Maybe a 1 or 2 tightness here, just a little.
Okay, just come the other way as far as you can.
That's much tighter. 4, 5.
Where up?
I feel it in my trap and all the way into my shoulder.
Very good. Let's do the other side, please. All right. What do you feel here?
That I feel it just tightening in and then kind of like trying to stabilize. You know.
Can you go that side as far as you can go? So it's kind of a frozen shoulder.
Yeah.
I mean, okay.
And then like that last bit is a little pinch right here.
And they may be different, right? The right from the left and so on. Okay. So you ready?
Yeah.
Okay. Number here.
3.
Number here.
2.
2.
That's like a 6 or 7. 5. 2. 3. 2. 2.
Okay. So let's check your elbow now. Give me numbers.
8. There it is. That's like a 7. 7. 5. 5. 3.
Okay. Very good.
Yeah.
Thank you. Number.
8.
Number.
7.
So let's compare to this one here.
2. 1.
Numbers.
All right, so this feels like a 2.
Yep.
Yeah, in my.
Okay. Turn your neck as far as you can. There we go. Just relax. Okay, go back and turn now this way and give me a number. Nothing, okay. Turn now this way, give me the number. What's the number?
Nothing. No.
Everything is good now, right? Just make sure you good range of motion. Good?
Yeah.
The other way. I'm gonna pull and you tell me where you feel the tension of the stretch.
Right here.
Okay, so breathe in by the nose, out by the mouth, and tell me when it's released. Do it several times. Any better?
I do feel it slowly releasing.
Okay.
Yeah, I can feel that release.
Released? Good.
It feels, so when you engage it, I felt it's tightening because it's just, reacting. But I do feel it begin to release. Like there's a gradual.
But now, how does it feel here?
Now I feel fine.
Okay. Yeah, where?
In my, in the
It's releasing, right? Yeah, here we go. Just breathe again. I'm going a little bit deeper. Just breathe. How does this feel now?
It feels good.
Okay.
It was crazy because it was like a lot of tension.
So you felt the tension release?
I felt, yeah.
Yeah.
I feel it still gradually getting better, like lighter,
Sure. Released?
Yes.
Good. Let's see now here. Where do you feel it?
It's on the inside.
Any difference?
Yes.
Great.
So yeah, I feel
Okay.
something there.
What about now?
No.
It's better?
Yeah.
Okay. So breathe.
Yeah, that's.
Released.
Yeah, you felt that, right?
Yeah. You feel it now?
Yes.
What do you feel?
Oh, no. I feel
It's gone now,
It's
right?
gone, yeah.
Okay, good. I do that on this one, anything?
nothing.
Okay, good. Excellent. Where do you feel the tension?
Right here.
Okay.
Yeah.
Any better?
Yeah.
Okay,
But
breathe.
now I feel it shift to.
Okay. Breathe. Better?
Yes.
Let's go there. Where do you feel it? Nowhere?
Nowhere. I feel relaxed there.
Good.
Mm-hmm.
Awesome.
Yeah. Oh, you feel that?
Yeah. What did you feel?
It feels like it's releasing
Where?
in my elbow.
Yeah.
I,
It's come from your shoulder,
yeah.
neck and shoulder. Here we go. Keep with me. It's been a year, right?
Yeah. Yeah, I haven't been able to extend that long in a long time without pain. It's
Awesome.
like my muscles are tensing to resist it, and then it just release. Like I still feel it's loose, So yeah, it feels great.
Your neck. Good. Chin up. And you tell me where you feel and breathe. Okay. Right there. Very good. Turn your head as far as you can. As far as you can like this. Good. And breathe. Breathe.
I felt super light.
Yeah.
Yeah. Super light.
Start to see what I'm talking about
Yeah.
now, huh? Yeah.
Like it felt like easier to sit up and to like it feels good. Like I feel like I have some extra length here. Normally people will sit hunched or tightened up. All of this is like relaxed. Feels good.
Ah.
A little too good.
Why? It's just such a...
You know, yeah, it's like, I feel like a weight is off. Like I'm really light. Yeah.
This takes lots of, all those steps that we have been making, the blowing technique, stretching, releasing all your soft tissue, your muscle, your shoulder, your hip. And after, just doing that decompression, that's all those steps that make you feel the way you do.
Yeah, it feels good.
You want to do some kick for us? So try your hip and tell me what's going on.
So with my hip, I feel, well, let me do a squat.
Okay, so stay down and tell me if it's getting better. Any change?
Yeah. Yeah.
Better?
Mm-hmm.
Yeah.
Yeah. Because on the other one, you got the inside, like that. Oh, wow.
What's happening?
It's releasing.
It's going away, huh?
Yeah.
How about now?
Yeah, that's like a 1. So before, remember, I was like, it's like, I feel relaxed, Yeah.
Actually, you feel normal.
I feel normal, yes.
That's good. Awesome.
Yeah.
You see the difference?
Yeah, it feels great. I've been doing these exercises to like improve my range of motion and everything, and I haven't been able to do it before,
And the reason why is because the stress was still there. The exercise doesn't really take the stress away. When we release the stress, after we can increase your range of motion and all that, and the exercise will strengthen.
Yes. Yeah. That's good. That's great.
Awesome.
All right. Thank you.
Not really. It's just kind of
Yeah.
going to my back, so
Any better?
a little bit.
Any better in your back?
Yeah.
Okay, breathe. Where do you feel it?
I feel it on like the inside of my shoulder,
Right here?
a little bit higher.
Here?
No, this towards me. So like.
Okay. Front of your shoulder. Any difference?
Yeah.
Breathe. Where do you feel it?
Feel that in my elbow.
Any better?
Yes.
Breathe. Where do you feel it?
Base of my leg on my right side.
As much as you can, Tom. All right, just go with me. How did it
Yeah, I
feel?
felt that. There was a pop right where it was tight.
On the right side?
Right, yeah, right there.
How do you feel now? Turn your neck. Just relax. This time I'm gonna loosen it up. I want your chin to be up a little bit. So it's gonna move. Maybe you can start to breathe a little bit.
Yeah, that felt like you got deeper. That's crazy. Yeah, feel like more stress got released. Yeah.
Can you tell us where?
I felt it all the way down my spine, but I felt most of it like near, like the lower middle. But I felt it all the way through. All the way through. Yeah.
Better?
Yeah, it feels really good. I didn't even know that was tight. Yeah, right there too. Feel like my shoulder blade.
How is that left hip?
It feels great. Not really feeling anything now.
Good. Gonna pre-inflate. Tuck your chin and good, and relax. So whenever you're ready, just take a big deep breath and hold. Good, close your mouth. Whew. Where did you feel it?
I felt it in my nasal cavity.
Can you breathe back? So whenever you're ready, take a big deep breath and hold.
Yeah, right there.
What did you feel right there?
It just pressure, just I don't know how to describe it. It just felt like something pushing down. Yeah, I can definitely breathe so much better too. Like, yeah. It's just like the initial inflation feels like a rush up and in. And I know all of this stuff is like sensitive tissue, so yeah, it's like it's a shock. But
Yeah.
It's like, as a kid, the first time you jump in the pool and the water just kind of rushes up. That's what it feels like, but like a little bit faster. But other than that, it's fine. Yeah.
Okay, so you can breathe much better, right?
Yeah. Oh, yeah.
You would say how many % better?
Oh, yeah, 100% better than when I walked in. Yeah.
All right, why don't you stand up, move around, tell me how you feel.
Yeah, I feel light, you know. I feel loose, I feel energetic, I feel balanced. That's the other thing, like with my hips, I don't feel like I'm favoring one side over the other. I feel like I'm balanced. I have a good, strong base.
So you will say you're more stable, right?
Much more stable.
Can you give us some kick a little bit
Okay.
for fun?
So, front, side, nice little roundhouse. So,
No
yeah,
problem?
No problem. Nope, everything feels good.
The lower part also when you go to tackle the guy?
So I could. This is the one that I was you know, I didn't even say this, but so the walk with the foot in, like there's no pain.